Welcome to Safety Experts Talk. Visit our website at creativesafetysupply.com/podcast.
The statistics are very clear. Employees spend more time at work than doing anything else next to sleep. It's just a no-brainer integrating some health promotion alongside health protection.
Companies traditionally have dealt with worker health and safety in distinctly separate ways. The safety manager says wear goggles. HR urges you to eat an apple. Those two approaches are blending in something called total worker health. Hi, I'm Dan Clark. Today we're talking with Dr. Bud Harris, safety and health expert, certified wellness coach, certified personal trainer, and owner of FitnessWork, LLC, from his office in Hillsboro, Oregon. Hello, Dr. Bud.
Hello, Dan.
I love your diverse rise to success. You were a helicopter logger, an electrician, you've been an EHS leader at Intel, Tyco, and Conway Freight, and now you're America's Wellness Sergeant.
Yes.
That's a great title.
I'm getting ready to take my dog for a walk and then go hit the swimming pool for a few laps.
Good. Sounds like a great career.
Yeah.
Total Worker Health began in 2011, developed by NIOSH, the National Institute for Occupational Safety and Health. In a nutshell, just what is it?
Well, simply put, Total Worker Health integrates occupational safety and health protection with workplace health promotion.
Oh, okay. So if you're healthy, you're more apt to be safe. Is that it?
Correct. And you're able to respond to risky things you encounter in the workplace.
Oh, so you have faster reaction time.
Correct.
Well, let's get into the nuts and bolts. What should a company do to start a total worker health program?
Well, it really starts very slowly because, again, it's not mainstream. It's something that NIOSH has been talking about for a long time. The way that Conway did it, Conway Freight, where I was injury prevention health coach for almost 6 years, is kicking off simple little choose to lose programs. Know your numbers. You either go see your primary health care provider or you bring in a contracted nurse to take blood pressure, glucose, cholesterol. So what you're doing is you're actually just sort of giving them a snapshot of themselves, where their health lies, their blood numbers, those kinds of things. And then it crosses over, for example, to their body mass index. Are they overweight? Are they obese? Are they morbidly obese? So those are some of the first steps, is just know where you are, and then move into simple things like hydration and what you talked about earlier about eating an apple. So it just slowly moves in. And then at Conway, I put together the Essential 8 stretch program. When the dispatcher would be dispatching the drivers in the morning and they had their safety meetings, I would be talking to them as well about something health-related, whether it was safe lifting or back health, while we had a certified stretch leader leading the drivers through the Essential 8.
I'd like to see photos of this. This is great.
Yeah, we had an entire 3 different locations doing pre-shift stretching while the dispatcher was going through their daily routine of dispatching the drivers. So it would be all the drivers. It was voluntary, but they would all do it. And we were building on something I was a part of at Intel Corporation, was called a certified stretch leader. Somebody has gone through a very simple program to answer questions about what muscles are we stretching, why are we stretching, so we can do it safely, and they end up getting in the middle of a circle of the drivers and leading a stretch while the dispatcher is talking to them about what they're going to be doing that day.
So it's downtime anyway. They would just be standing there listening to someone talk.
Yeah, very successful, and it was implemented at a lot of the larger terminals across the Conway Freight system. It definitely showed that it lowered the soft tissue injuries and just nagging things. I mean, a driver would get up, get out of bed, get in the car, get out of the car, go in the office, jump in the truck and start throwing boxes around. It behooves them to take the joints through their full range of motion before they embark on their day.
Yeah, that's a great warm-up. Well, this program began with NIOSH, the National Institute for Occupational Safety and Health. What do they offer to a company to begin a program other than a list of things to do? Do they offer any kind of incentive for companies?
Not at this time. That has been thrown out by a lot of different companies. Again, this can be quantified on a lot of different fronts. Healthcare providers, for example, out of pocket, as you know, with the Affordable Care Act, has got a lot of press, both good and bad.
Mm-hmm.
What a lot of companies are doing now is they're giving employees a lower out-of-pocket cost if they participate in different events. For example, I did some work at Rite Aid here in Portland. I came in and did what was called the lunch and learn, where the employees would bring their sack lunches to the break room, and I would present 45 minutes on a topic.
Oh, I see.
And one of them was nutrition, and one of them was starting a walking program and being more active. So they would receive a discount if they did 2 lunch and learns and 2 active events like 5K walk and maybe another event. So their out-of-pocket would be substantially less if they basically did those 4 activities and did their annual health risk assessments. So what you do is you utilize the resources that are available to you. Total Worker Health, as far as the NIOSH website, does have what's called issues relevant to a total worker health perspective, and it lists out all the elements that would be considered total worker health. Safe Corporation, the state workers' comp program here, has just recently been certified as a total worker health, and on their website, safe.com, they have a lot of resources as well.
And that's SAIF.com.
Correct.
Okay, great.
When I was at Tyco Electronics back in 2005, I subscribed to Wellness Councils of America.
Okay.
The acronym is WellCOA, wellcoa.org.
Mm-hmm.
And there, for a small fee, you can have all different kinds of bulletins, newsletters, quizzes, PowerPoints, interviews. It's just a huge resource of how to get started, even working with executive management, how to get the initiative going. And I've been using them for 20 years. I became a faculty member for WellCOA about 2 years ago. So there's just a lot of resources out there now, but getting started, Dan, slow, starting a hydration campaign, getting an apple a day campaign, starting a walking program, looking into your healthcare providers, what they offer. A lot of the healthcare providers actually have a consultant on staff that is dedicated to the employer that's obligated to provide these type of resources, but the HR department is just so overwhelmed that they just don't reach out and get that person on site and get those free seminars coming in.
Oh, I see.
To the facility.
Well, with Total Worker Health, does the safety manager, the traditional safety manager, do they now need to have training on how to advise workers on a healthy lifestyle?
It's moving that direction, and it usually starts with ergonomics.
Mm-hmm.
Stretch routines is nothing new. A lot of the bigger companies, Johnson & Johnson, Safeway Corporation, they have been doing ergonomics consultations to discuss work design, joint health, and arthritis prevention. So that's been going on for years and years. And I have a background as a safety engineer. It wasn't really a bulk of our training, but as we see, over 60% of injury types now are becoming soft tissue. When I was at Intel Corporation, 1 month, Tony Brace, the ergonomist, said 9 out of the 12 injuries was related to people just being out of shape. Slip, trip, and not even falling.
Wow.
Or using the mouse all day and then getting sort of a wrist injury. More and more people are just deconditioned, low back pain. It's easier to slip a disc just bending over, doing your day-to-day job. I mean, industrial athlete, that was a term coined about 20 years ago when we're out there working. For example, a truck driver jumps in the back of a trailer with a pallet jack. They move around heavy loads. They're asked to downstack pallet after pallet, just like an athlete would work during the day. So there's got to be some proper prep and a little bit of attention. But yeah, the safety manager now has to sort of look down that road.
they also still have to continue with the traditional risk assessment, root cause analysis, monitoring leading and lagging indicators. How is a safety manager going to have time to do the additional soft touch stuff?
It's going to be a challenge. It definitely is. But what I did is look to the free resources that are available. The healthcare provider, the local YMCA. For example, New Seasons offers nutrition classes for free. There's so many different personal trainers out there that want to come on site and do free presentations and hope they would secure some kind of work. I did a lunch and learn series for a large container company. I came in once a month during shift change. It was reasonably priced, but I gave them a menu of things that I could talk about. They chose off the menu, and I would come in for 45 minutes when 2 shifts were in the break room and with a handout and a demonstration and a discussion. And the safety manager, all they had to do was pick up the phone and call me.
Right.
There's just so much out there. It's just, I think the biggest inroad to total worker health is the safety manager has to accept that it needs to be done. They don't necessarily need to do it. They just need to organize it.
Well, it's because a healthy worker who's not overweight is going to be a more efficient, safer worker, right? I think you were telling me that earlier. Somebody who is not overweight is going to be able to do physical labor much more efficiently, of course. They're going to be less likely to get injured because their muscles are built up better and that they can actually get more work done at the end of the shift.
Correct, exactly. There's a new term out there. Most people have heard of absenteeism, but they haven't really heard of the term presenteeism, which is a metric from the productivity management world where a person comes to work and they're expected to perform as a 1.0 FTE full-time employee, but due to chronic illnesses like obesity, diabetes, low back injuries, they're not able to perform up to what they did earlier, and maybe they're making more money because they had been there a while, but they're doing less work than they did before, yet they're making more money. So they're starting to quantify that, and they're saying that presenteeism is the largest cost in the human productivity management cycle. You've got your direct costs when somebody pulls their low back, for example. Then you've got your indirect costs when somebody has to come in and work overtime to replace that person. But you also have the presenteeism cost where a person comes back to work and now they're on limited duty for a period of time because they put on 100 pounds. I have used the example when I speak at safety conferences, Dan, where you get hired at $15 an hour pulling boxes off one conveyor belt and putting them on another, for example, at a freight terminal. Then you gain 100 pounds and you get paid $5 more an hour. Now you're making $20 an hour, but you're actually doing less work than you did before, and now that's called presenteeism. Presenteeism also is coming to work and surfing the internet or getting on your Facebook or playing fantasy football. That's also considered being at work and not actually participating.
So be more disciplined as a worker, but also be disciplined with your health because it could also save your job. Is that what you're saying?
Well, yeah, I'm not sure that one could be let go because they're doing less work due to medical issues. Surfing the internet, probably. The way Safe Corporation tries to straddle the aisle of health promotion and health protection is they promote health at the organizational level by helping employees identify and control issues that work against alertness, productivity, and safety. These can be simplified into 3 categories: what to do, what to avoid, what to eat. In those 3 realms, they work on moving more, getting better sleep, healthful foods, drinking the right kind of water and often, dealing with chronic stress, eliminating tobacco and nicotine.
Oh, okay. So you got what to do, be physically active, get sleep, what to eat healthy food, drink a lot of water. What to avoid is the chronic stress and cigarettes or tobacco, any kind of nicotine input.
Correct. And that's how they break it down simple. They also have ideas, organize walking meetings, compete as a work team in community events, serve fruits and veggies for snacks, organize a volunteer activity for the organization. A lot of different things, a lot of different challenges, a lot of different free resources that are out there. The YMCAs I mentioned, the Parks and Rec, community fitness events. There's just a whole host of things that are free or almost free that a safety manager can reach out to and organize. It usually ends up in the lap of the HR department, as you said earlier.
Mm-hmm.
What I did at Tyco Electronics when I arrived, the HR department was 6, and it was 3 when I showed up. The wellness program sat on the shelf. So after about 2 to 3 months, I asked if I could pick it up and run with it. Was able to do that. Was able to get gym membership up from 200 to 500. Started a stretching program, giving people extra time to stretch in the gym, embedding it in their job safety analysis that if they had a job, for example, in shipping and receiving, they were expected to stretch and were given time to stretch.
Right.
And the ErgoWell program that I developed was nominated for the North American Tyco EH&S Excellence Award.
Oh, that's great. But it sounds like you couldn't have done any of that without checkoff from management. This has got to start from the top down.
Yes. The old saying, walk your talk. Management not only has to support it, they have to convey they're going to buy into it, and they also have to be seen about doing the thing. So when we started a walking program with the city of Wilsonville, when they came in and gave pedometers to all the employees, the managers upstairs had to be seen wearing their pedometers.
Ah.
When we started inter-plant flag football and softball teams, they had to be part of those as well.
Oh. Well, I'm a horrible football player, so I guess if I were a manager, I'd have to get out there and humiliate myself. But I guess that's part of it, isn't it?
You can block, right, Dan?
Well, if we had a total worker health program that's going to start at company X, say it's a construction company or something, you want to get the safety manager together with the HR department, or even if you don't have an HR department, you're a small company, what's the first thing that you want to do to be able to make a plan, to write it down or to type it up?
The first thing I would do is you want to get it to the safety committee. So we changed the name from safety committee to safety and health committee. And then from there, we start documenting in our minutes. We get some proactive champions on the safety and health committee. There's no shortage of people out there that want to help other people get healthy, or there's no shortage of people that are already healthy and active. And believe it or not, they want to fly the flag if given the opportunity. And if you get enough of those on the safety committee, then it becomes sort of a safety and health promotion committee. And then from there, things can be added to the safety committee agenda, like filtered water would be one. At Tyco, for example, that's one of the first things that went on the agenda, filtered water. After that, it was a designated walking route where people could walk around the plant without having to put on their safety gear. So it's just one step at a time. Like you alluded to earlier, management has to buy into it. They have to communicate down through the organization that this is something they're going to do. It becomes part of the charge, the normal business of the safety committee. It's just business as usual. And then more and more aggressive things start being added to the agenda. For example, 5K, that's what we did at Conway. We ended up getting 45 truck drivers and their family members out to a 5K walk-run. Many of those ended up becoming a runner on one of my Truckers the Triathletes team, and then they start getting bikes, and they start biking with their families. Then they want to be a runner and a biker. Then they go to the gym and start swimming, and they become full triathletes. So
amazing.
The statistics are very clear that employees spend more time at work than doing anything else next to sleep.
Wow.
And it's a good place for social support. It's a good place to promote healthy messages. The employer reaps the benefit of a healthier worker. It's just a no-brainer integrating some health promotion alongside health protection. Somebody that injures their shoulder is usually a $75,000 issue, and a low back $50,000, where somebody that smashes a finger, for example, could be $2,000 or $3,000 when it's all said and done. So the soft tissue injuries are the costly ones. In the safety world, we spend a lot more time on making sure people have safety glasses, hard hats, safety toes, and gloves on than people lifting correctly and drinking enough water and getting enough sleep.
And having the right muscle tone to be able to lift correctly.
Correct. All of those things. I believe that we're moving down that road, and I think with Safe Corporation out here on the West Coast being the first certified total worker health, a lot more safety managers are getting their workforces to stretch. A lot more HR managers are bringing in contract nurses to do blood draws so the employees will know their biometrics, their glucose numbers, their cholesterol, their triglycerides, those kinds of things that you need to know to sort of take a snapshot of where you're at.
Right, so you can have a baseline and have goals.
Correct. Knowing where you're at and then knowing where you need to go, and then let's bring that delta together.
So we have the safety committee. Does the safety manager and the HR manager sit on this committee, and do they lead it?
Yeah, they're part of it.
I see.
But yeah, in all organizations I've worked in, I've been part of the safety committee.
Okay.
In an interest survey, that's another big step one in starting a health promotion / wellness program, is we need to know what the employees want. Maybe some employees just want more light. They want a nicer staircase because just getting people to take the stairs is a big one.
Oh, instead of the elevator.
Yeah, some people are having artists come in for free and making their staircase really pretty with beautiful art. And then employees will want it. Just simple things like that, getting your 10,000 steps a day, getting a pedometer and starting to track it, and doing little competitions with your coworkers. Hey, how many steps do you have today? Oh, I'm at 7,000. Well, we need to go out for a quick 10-minute meeting and walk around the campus and get our 3,000 so we can end the day with our recommended 10,000 steps.
10,000 steps. See, that's something I didn't know. So I can see how it's really difficult for a truck driver. Stretching is one thing to be able to begin that program, but you got them into the Truckers to Triathletes program. I assume that's more than 10,000 steps. So,
yeah. Well, that's getting them to walk around what's called a long box. That's the really long trailer you'll see on a tractor. Walking around that 38 times is 1 mile.
Oh, really?
So
okay.
10,000 steps in general terms is 5 miles. It's 2,000 steps per mile.
Okay.
And you burn about 100 calories per mile walking and 200 calories running per mile. So that's how we get people started, is while they're waiting. A lot of the truck drivers have to wait when they pull into a terminal for the trucks in front of them to process, so they have time. So just getting them motivated enough. You mentioned goals earlier. Some of my goals to the hundreds of truck drivers that I worked with was, I just need you to get out of your truck and walk around while you're waiting for the customer to download you.
Right.
Pushing the bird out of the nest is usually the hardest part.
Wait, I can't unload right now. I've got 3 more laps to make 38 around my truck.
Yeah, it's true, though.
That's dedication.
It starts feeding on itself. After somebody starts feeling better and their low back pain starts to ease, and they're eating better and they're drinking more water. And also it's a mental outlook too, Dan. The famous law of attraction, if you focus on negative things, the traffic, the weather, if you focus on it day in and day out, you're going to attract more of it into your life. So we get truckers to say, this too shall pass. Somebody cutting them off or road closures. Start focusing on all the positive things in your life as opposed to all the crap going on.
Well, there's certainly no shortage of that, is there?
Yes.
Truckers to Triathletes, we've talked about this a little bit here and there, but how did you start that at Conway Freight?
Right. So what we did is met a truck driver who was working what's called line haul. We were doing a Biggest Loser competition, and he was really frustrated that he wasn't able to make any gains frustrated to the point that he went on a super duper cleanse program, which I actually didn't recommend, but he did it anyway. And then when he was done and he did lose some weight, I challenged him to do a triathlon.
Oh.
At that point, he went ahead and trained after he worked 12 to 14 hours a day doing spin classes and swimming. He inspired a couple of other drivers, and we ended up with 3 drivers doing their first full triathlons. Then it spread to 3 teams, and now we're up over 100 trucker athletes and their family members doing triathlon events around the country.
And it's in your 7th year.
7th year was this year, yeah, exactly.
Wow.
We've got a couple truck drivers, one that's lost 100 pounds, and another trucker who's on his way to losing 100 pounds in a couple weeks.
Mm-hmm. So and that's a great program because, let's face it, your typical blue-collar worker is tough to get off the dime and into a gym.
Yeah.
Maybe it's a cultural thing. And this gets us back around to total worker health. Does Joe Sixpack just roll his eyes when he hears a phrase like total worker health? Yeah,
it is a challenge to get your traditional blue-collar employee to get into a gym. A lot of their I wouldn't call them excuses, but their explanation is, hey, I work 10 to 14 hours a day. I get my exercise. I don't need to go to a gym.
Uh-huh.
But their health metric screenings shows otherwise.
And they're not getting the aerobic workout that they would, no matter how hard they work, right?
Correct. Yeah, they're not getting their heart rate up for extended periods of time. Tight hamstrings create the low back pain that 80% of Americans will have. There's just a whole host of things that functional training really helps with.
Right. Well, we're close to the end, Dr. Budd. Any final thoughts on starting a program of total worker health?
Yes, just decide to do anything consistently. That means an apple, changing out some of the snacks that come into the facility, having water bottles out on the job sites. Just pick something and make it consistent, and then pick something else. Get the safety committee engaged. After listening to this interview, go right back to engage HR and their supervisor and say, hey, what can we do to just do anything and get this started? Because it's not going to happen overnight, but if you start it today and pick one thing, in 5 years, you'll see a huge difference in not only productivity, but morale, absenteeism, as well as presenteeism.
Overcome inertia.
Yes, exactly. That ball of mass is sitting there, just vibrating, not doing anything.
Well, Dr. Budd, I'm sure people will want to check you out on Twitter and Facebook, and those are linked on your website. What is that? I'm
at wellsgt.com. It's abbreviation for americaswellnesssergeant.com. That's my speaker website. I do a lot of speaking, and that's where you can locate me if you would like me to speak in an event.
It sounds like you're always on the keyboard there. You better get out and do something.
I plan on it. Got to stay busy and got to stay active. I got to walk the talk. Right, Dan?
That's right.
Yeah.
Very good. Thank you, Dr. Budd. Our guest has been Dr. Bud Harris, CWC, CPT, and owner of FitnessWork, LLC, from his office in Hillsboro, Oregon. I appreciate you listening to the podcast. I'm Dan Clark.
Thank you for joining us on Safety Experts Talk. If you have suggestions for future podcasts, send them to podcast@creativesafetysupply.com. For more safety experts talking about safety news, OSHA regulations, PPE, Lean, 5S, or continuous improvement, go to creativesafetysupply.com/podcast.